If you have knee arthritis, you might find it hard to walk for exercise. But don't worry, there are many other great options. In this video, I'll compare the benefits of a seated stepper versus a recumbent bike. Both allow you to get knee range of motion as well as aerobic exercise without bearing weight on your joints. I'll even share how they can help if you've already had a total knee replacement. By including seated exercises in your routine, you can boost movement and circulation, which you might even find helps you to walk more comfortably. So let's get started. When comparing a recumbent bike to a seated stepper, one of the biggest differences is pattern of motion and range of motion. A recumbent bike goes in a circular motion, and as you can see at the top here, it requires quite a bit of knee bending. That can be quite difficult for people who have knee arthritis or who have had a recent knee replacement. Now you can adjust the seat to come further back, and that requires less knee bending, but you'll note that it also becomes harder to reach out to the front. Additionally, if you just can't get around, you can do half revolutions, but that obviously cuts down on the cardiovascular benefit. Conversely, with the seated stepper, it has more of a linear back and forth range of motion, and so you'll find you don't need quite as much knee bend at this top part of the range of motion in order to keep a nice smooth flow. Now, the most well-known brand of seated stepper is the New Step. The one that I'm using in this video is the Teeter Free Step LT7. This one's quite a bit less expensive than the New Step, and in my case, Teeter did actually send this to me for free for the purpose of making this video, but all the opinions I'll share here are my own. Next, let's go into muscle activation. With a seated stepper, obviously you have upper body and lower body, so you're working more muscle groups, and that results in overall greater calorie burn. Additionally, because it is more of a back and forth range of motion, you get a combination of both quad and glute force. With a recumbent bike, you use a little bit more quadricep force. There's less hip force involved with it, and you also get some hamstring force to bend the knee as you're coming up over the top. As far as functional carryover, the stepper probably is a little bit more similar to movements you do in real life, such as walking or climbing stairs. Now, if you do enjoy biking outdoors, the recumbent bike is going to be more specific to meeting the demands of riding a real bike. And by the way, for most people with knee arthritis, I think both the recumbent bike and the seated stepper are better than an upright bike, because with an upright bike, you have a lot more gravitational force to control, which makes it much harder for most people, especially after a knee replacement. And speaking of after a knee replacement, most patients that I've seen do better with a seated stepper right after the replacement, again, because it doesn't require as much knee bending, and the motion is a little bit more natural than having to do that circular over-the-top motion. Once you get further along in your rehab process, you may find the recumbent bike a little better if you're really looking to push the range of motion, because it does require more knee bending. Additionally, if you're looking for quadricep strengthening, you'll probably get a little better workout on the recumbent bike because you don't have your arms and glutes to help you out as much. Overall, for most people with knee arthritis, I'd say the seated stepper probably has a little bit of an advantage because it requires less knee bend, which means less compression underneath your kneecaps. It's a full body workout, and the movement pattern is more similar to walking and climbing stairs and other functional activities that you do in real life. But you can't go wrong with either one. Any activity is better than no activity. Now, if you'd like to learn more exercises for knee arthritis, check out this playlist over here. But before you go, if you found this video helpful, make sure to give it a like. And if you haven't already, subscribe to our channel so you don't miss out on future tips. Thanks for watching, and I'll see you in the next one.